Hello, everybody. Good evening. Good to have all of you here. We are very excited to have Dr. Shirin. So, hello, Dr. Shirin. Welcome to our live. And can we please have your introduction?
Yeah, thank you so much, Dr. Vidhi, for calling me or for inviting me on your channel and talking about various aspects around dentistry, around healthcare. It's really exciting. And so around my with my background, I completed with my BDS in 2009. Then I worked for a year as a general dentist, and then I changed my career. I basically did my healthcare management. So my specialization lies in health informatics, wherein I have been working with products in the healthcare and hospital environment, like working around HIS, working around electronic medical records, lab information systems, mobile applications in healthcare, and so on and so forth. So I've been working in that space for almost like 6, 7 years. And yes, till now also, like now I have been in a consulting mode basically, and also into academics. So that's my current work that I'm doing, consulting and teaching and training people in the space of health informatics.
Oh, wonderful. Back in 2009, what made you shift after your 1 year of general dentistry practice? What made you shift to health informatics?
So I always wanted to do management. In
Mm.
my internship, I was very clear that clinical dentistry, just, having the kind of person I am, I will not be able to survive in a 4x4 chamber. I got to know this very clear while I was in my internship. So I tried for a year if I could, get placed with hospitals and all of those other healthcare facilities. I don't know, luck or fortunate, unfortunate, I don't know. But then management was something that I really, well, while I was working in clinic also, I was very excited when I always had to work around patient management, or appointment management, inventory management, like from the all the perspective, how do I scale up, or how can we scale up, how can we market our dental practice, all of those things back in 2009. So that is why I chose my next specialization as management. And when I actually wanted to do hospital management, so when I joined IHMR Delhi, at that time it was the only organization or institution, rather I would say, in India which was they were providing health informatics. And it was a fairly very new field that had that basically came in India. Health informatics was always a Western culture, or in the Western world they were basically talking about it, but then in India also digitization started back then. So we had a 10 days workshop to understand what health informatics is. And when I joined that workshop, I was quite excited. The field was very it was upcoming. It was, working around technology and how can we integrate in healthcare sector, make sure that the patient care outcomes can be enhanced using technology, all of those things, like what you are doing with dental dose, right? It's just that. And that was the point where I decided, okay, this is where I want to be.
Wonderful. When talking about patient management, having the right digital records and the information of patients, we know that we have been lagging behind if we compare to the world, and as how are they saving their information and making use of the analytics which is derived out of those patients, right? I mean, we see so many senior practitioners in medical, in dental, and still when it comes to patient management, it's all the traditional way of maintaining the data on your register, which it is very difficult in order to derive an analytics or any pattern if you want to prevent or predict any particular disease. So what do you have to say about from then to now, over 6 years, 6 to 7 years that you have? What has been the biggest change with respect to patient data management in our country?
There has been a lot of change. And I mean, in the past 10 years that I've seen, like 2012 is when I graduated with health informatics. It's almost been 10 years in this space. And I think we have come a long way with, now we know that even government is also leading initiatives in that space with Ayushman Bharat digital mission. And I'm sure going forward, when this mission will be rolled out pan India, when it will be launched, and every healthcare facility will have to adopt with digital systems in place. I think we have started it. And it was, like I said, 2012 is when Practo, Doc Engage, all of these platforms, they were starting to develop. We were a part of that development. So it started back there. And now, yes, people have started acceptance. I think in clinics, the acceptance has come. Many clinics we see now, they are using electronic record systems. Even in hospitals, if you see like the Good Shots Hospital, Max Healthcare, Narayana Ridalya, they're all using systems in place. So I think we have come a long way. But yes, there is more. There's more aspects of health informatics that have to go down, and we will see that change in the coming years.
Correct. What, according to you, is the one major thing which is still missing with respect to the management system, right? And you would like to see it uh, being used by, say, doctors and also being accepted by patients.
I think, see, it's very, we are in very nascent stages, I would rather say, like to pinpoint any missing points, because it's just the start of it. We've just started that acceptance. 10 years back then, there was no acceptance also. Let me be very clear. When I joined health informatics, we had to face a lot of reluctance from healthcare providers, right? From hospitals, from the staff of the hospital. There was a lot of reluctance, but now people have accepted it. They are using systems. And I think that's again, so 10 years back, if you had asked me, I would say reluctance and acceptance, adaptability, that was the missing factor. Going forward from where we are today, I think it's more as we progress, it would be the data, because that's what we are all trying to do, right? To gather data, to analyze, and to see, predict, like you said. uh, and in fact, in your case also, like what dental dose is doing. And I'm really, I was very impressed by the kind of work that you've started doing. And in dentistry, there have been a lot of AI applications in the Western world again, but here, I think in India, I think you're the first one who started this. And making it accessible is very, very important. So accessibility, affordability, I think these are two major, missing points that we should now focus on, so that patients also are aware of various technological platforms that they can use sitting right at home and then getting consultations done. I think that's very, very important.
Absolutely, absolutely. Thank you so much for your kind words, right? When we started Dental Dose, the whole mission and the vision was aligned to the very same discussion that we are having. Even though right from 2012, as you mentioned, we had this listing aggregating platforms. But with respect to that, what I think one thing is missing is standardization of the data and access of data to the practitioners and to the patients. Now, just recently, we had the right to health, Rajasthan being the first state to do that, right? So that is something missing, and now we are working towards that. But having said that, how did we start at Dental Dose was the first and the foremost problem that we saw from the patient side was again lack of awareness, super lack of awareness.
Yeah.
And then, as you mentioned, accessibility, right? We have more number of dentists than required, but when it comes to the division of dentists, it's not equal. It is very haphazard in our country, and that leaves us with, the second worst country when it comes to oral health. It leaves us with the
Yes.
capital of the world when it comes to oral cancer. So when I believe the information is given in a very simplest form to every common man, which they are able to consume and then get self-motivated, then I think the difference that we are having with respect to the prevalence rate and the total number of people visiting dental surgeons will, come down. And that gap will be closing day by day, one patient at a time.
Correct.
Yeah. So,
Yes.
yeah, what we started was again through this awareness, which led us the core area which we are working right now with respect to AI. The research work had started back in 2018, because if you really want to make a true AI company, you need a lot of data, which is segmented, which is annotated by the professionals, reviewed, moderated, and again trained in a model which is not existing before. So, we put together all these small steps, and here we are, very proud of our accuracy and the speed of which we are able to give at least the preliminary diagnosis to the patient, which will then instill that seed of, further actions, which as professionals, what we are expecting.
Correct.
Yes.
And I think if you remove the patient factor now, since we have been talking a lot about on the patient factor, I think with platforms like Dental Dost, or there are many other platforms also I've come across. They also mean it's also a way of educating the newer graduates. That's not just the clinical dentistry that you can focus on. There are so many other ways by which you can use that knowledge that you have gained over a period of 5 years, and then you can do so many other things. It's very important to identify, I think, those skill sets which can help you to identify or find your fit in the healthcare industry, because it's a huge industry that we have. So I think that's again a very good initiative and a good thought that we can basically plant in the newer generation now coming.
Absolutely. The first seed of the impact program that we've launched came, and I keep repeating this example, when I had just finished a lecture talking about AI in dentistry and the new opportunities that we have for dental surgeons, right? Doesn't matter if they've done their undergraduate, post graduation, or also PhD. Everybody has the access to these opportunities. And one brilliant student, she comes to me and asks that, okay, shall I start learning Python or any other machine
Mm,
learning language? And I was like, you don't need to do that, right? We do have sufficient number of engineers who are ready to make these algorithms. What we require is to, as you rightly mentioned, identify the skill set of as a dental surgeon, and how am I able to convert my clinical knowledge
yeah,
into a non-clinical way, or into a language which a computer is being able to understand and accept it in order to get trained.
correct.
And that was my first stop. Okay, because again, second example, we have been receiving a lot of application where people want to join with us, join our mission. But there's a huge gap between what is taught in the academics and what the industry really wants. And I soon realized that I went back to our time journey. I thought, when these IT services first started in India, late 90s, and they're still
Yes,
doing that, right? They have this 3 month, 6 month training program, and then they recruit that particular individual into the job. I was like, well, this is the high time that we should also start something where the leaders who are already practicing this kind of different opportunity, we should open that for everybody.
correct, correct.
Yeah. So
I
how
think
has
that's awesome.
your experience been in, even you are training new graduates, right? Into the health informatics. How did you come across? What is your process?
So my process is usually I have a small course of 8 weeks wherein
Hmm.
we talk about the basic concepts of health informatics in terms of like what exactly health informatics. And before even I get into the details of health informatics, it is very important for us, though we are already taught about this when we are doing dentistry, but the healthcare perspective, who the main players of healthcare, like the patient, the providers, payers, and then the public health, what are their role in healthcare industry, right? And then what is the ecosystem behind it? What are the different types of hospitals that we have? What do we mean by outpatient, daycare, inpatient? What is the difference? So just the basics of healthcare first, and then we delve into health informatics in terms of, okay, what do you mean by, say, a hospital information system? What does it do? How is it different from an electronic medical record? Or how is it different from a lab information system or a pharmacy information system? So basic concepts, that we cover. Then how do you, if somebody wants to work around electronic medical record, then what are the components that will go into building an electronic medical record? What are the standards that are required? I'm sure when you build this mobile application for dental dose, I'm sure there are very standards that will go into development of a healthcare product, right? There are standards like security standards you have to take care of. Then there are web standards that one has to look at. So all of those aspects are taught in the course, the basic concepts, and then a little bit about information technology, in terms of like, what do you mean by system support, system maintenance, how is it being done, all of those things. It's a very basic course which gives, the whole idea behind was to basically educate the students, because there's a lot of, I've seen over I think 5 6 months that a lot of students come up to me asking that what is health informatics. I am planning to do a master's course in health informatics. Do I need to learn technology, or the language program? Like you correctly said, they will ask me questions like, should I learn C++? Should I learn Java? Should I learn Python? Should I learn R programming? And I'm like, if you start learning and start coding the systems, what will the engineers do? You don't have to eat their job. So you have to provide your clinical knowledge, you have to provide your healthcare knowledge, and make them understand how to build product. You have to give them a blueprint. And a very classic example that I give them is, when an architecture is hired to build a building, they're basically asked to give those miniature buildings, right? The
Correct.
miniature blueprints that they provide. So architecture is not building the building, he's not constructing it, he or she, but they are actually giving like how a building should look. The same way as a doctor, you have to give how the software will look like. What are the components that will go into a software if you're building whether a dental product or any healthcare, say child healthcare related or cardiology related. So how a cardiologist will be capturing patient data, that is what you're supposed to tell the developer, and then the developer will be developing that product. So that is the whole idea behind the health informatics course that I have. It's just for beginners to make them understand at a basic level what this course is, and then they can plan to do a master's program whether in India or outside.
Absolutely, totally agreed. But many of the software or startups do not achieve that kind of product market fit. Why? Because only if the engineers have thought about the
Yes.
problem and they are making the product without consulting the client, which is the doctor right here, will be using it, it's of no use. And that's why
Yes.
there is the internal dashboard or the system management system that we use to manage our own patients, which have been
Mm.
asked by so many partners of ours that if we can use that, can you give us the access, because it looks so easy to use. And since the inputs have been given by dental surgeons themselves, we know how many clicks do we want. We know that we do not want anything complicated. The solution is actually very simple. But people think that we need to add 10 more features, we need to make it look uh, uh, classy, or in that process they end up making it more complex. uh, so that is one. And even in our impact program, talking about that, we had a lot of doubts coming in about what exactly will we be covering. And that's why it's a 8 weekend long program where each week has been dedicated for a particular domain. In the first week, we give the introduction and overall analysis of what is the scope, the total vision of dentistry, and where is the world heading to? What's the future of delivery of healthcare, right? Then second week onwards, we also give them the innovations which is currently being practiced in clinical dentistry. It's not just limited to what they've been taught in the college, right? And then third week onwards, we have deep dive in research, in teleconsultations, video consultations, importance of data, what is annotations, how can you practice it, the thing that you give diagnosis looking in the patient's mouth visually, how do you convert them same if you have to look in the photo and make a judgment, right? Because that's a different thing. And then so on and so forth.
Correct.
Everything in detail are covered in this impact program.
Yeah.
Wonderful. So what is next? What is your next goal with respect to this? Are you starting something of your own, or how do you plan your journey ahead?
That's YouTube channel by the name of What After Dentistry, which I started again in January 21,
Hmm.
thinking of, okay, at least start with the awareness level, because it's with dentistry, it's not just traditional clinical dent. If you have the flair of doing it, and if you want to excel, and if you really have that passion to work as a dentist, good, go ahead, excel into it. But then there are again other aspects. It's not, in today's time, I think it's not just clinical dentistry that you should be good at. You should be good at managing it from a business perspective point of view. I think that's also very important. So that's another area that we also tap into. We have industry experts who talk about this dental practice management. So that is one area where I started the awareness level, that this these are certain courses that you can do and all of those things. So the whole idea behind that YouTube channel was to increase the awareness of what all you can do after you're completing your, whether it is BDS or MDS, uh, clinical and non-clinical both. Now I think I've scaled up to a level where we have almost around 100 plus videos in this various career opportunities. Just imagine 100 careers that we can think of after dentistry. So currently I'm pursuing my FPM also, which is a fellow program, research fellowship program in management. And I plan to like go ahead with more talks on healthcare management, because that's where my domain lies, that's where my expertise are, talking about how can we utilize in technology for, global health perspective, launching my own courses in terms of public health informatics, or health informatics. Like I said, I would like to obviously scale up, because it's a very small course that we have right now, but eventually I would like to scale up and provide a more detailed course in health informatics. So that's the plan. But I don't know, with FPM, when you start doing research, you have so many other things that you start working on. And I maybe, I mean, like 3 years down the line, it might just change.
Right, right. But amazing, right? 100 plus videos on different careers options which are available. I'm so glad that people like you and me are constantly putting out content there and talking to young people, showing them what all ways are possible, right? Which earlier looked like an impossible way. And what among all your the videos you might have derived some analytics, right? Which are the commonly seen opportunities or most chosen? In if you can tell me a change of trend in when you started in 21, right? So the trend which you saw in the year 2021 and the change that you see in 2022, has there been a shift of mindset with dental professionals about non-clinical and other opportunities?
Yes, there has been. I think even back before 21, I would say there is a shift.
Hmm,
Pandemic basically just made a shift. Even before that, dentistry, we all know like there is scarcity of dental jobs. Nobody wants to work. Distribution, like you said, we do have dentists, but if you compare with the Western world, we are still having less number of dentists as per the, the kind of population. If everyone, I think I was having one of the discussions with one very renowned professors in periodontics, Dr. Krishnaraj, and
hmm,
he mentioned that for research studies, it has been identified that only 7 to 10% Indian population is visiting the dentist because of lack of awareness. Just imagine if this 10 percentage, if we can convert it to 50%, do you really think to dentists today that we have, the amount of dentists in the country that we have, they will be able to, they'll say that the saturation is there, they'll be flooded with patient flow.
correct.
So, which is correct actually. And that's where the shift we have seen, that I think it's very important. People have started adapt. When I changed my career, there was a lot of reluctance from my own seniors and my batchmates, my professors. They say, why are you doing this? There is no, I mean, like, why to get into management? You do dentistry and all of those things. But now I think that acceptance has come. And when you
Right,
ask me which are the most accepted options as of now, so right after BDS, if you say non-clinical, healthcare management, public health, hospitals, hospital management, or health IT. There is a wave, like everyone wants to get into these three fields, either of these three fields. And then there are many people who, like anyone who is willing to start work right after BDS and not do any kind of courses and all, then they can get into like clinical research, pharmacovigilance. That's another these are the other upcoming, or I would not say upcoming, they were still there, but then
correct,
acceptance for these two fields. Because again, you don't have to spend any money to again get masters done. You can directly work with pharmaceutical organizations in the both the spaces, and they'll train, like with your impact program, what you're doing is
correct.
training your people the same way that they'll be training people, and then they will be hiring.
Absolutely, absolutely. This is very important. You rightly mentioned, right? We have a lot of processes, software support to deliver more advanced form of treatments once the patient is in the clinic. But that first mile delivery of making patient aware and then bringing him to the clinic is where we need to do a lot of work. Where again, I think through our AI solution, where people are able to access diagnosis through their smartphones, uh, the wave has already started. And I want to collaborate with more people. I want more people to join us in order to, scale up the kind of impact that we are making. Just 10% of them visiting out of 75% prevalence rate we have, more 65% needs that awareness and motivation to get the corrective treatment, obviously done in time, but also to change their perspective towards preventive care, towards holistic care, which will prevent the other consequences, right, of as grave as oral cancer to even normal as, not starting a cavity if you can do sealants in time.
Yes.
Wonderful. So I think here I'm done with all my questions. Do you want to give any takeaway messages to our users?
I take away, I think for me, it's always what I always feel is constant learning. Learning and unlearning is very, very important if you want to grow in whichever way you want to grow, whether clinically, non-clinically. I think that's very important. And I'm sure with your impact program, people would be learning a lot of other stuff which they were even not aware, in terms of, okay, how can we apply our dental knowledge or the knowledge that we had gained in this particular manner also. So I think that's very important. Learning, constant learning and unlearning will definitely help anyone to excel in whatever way they want to.
Thank you so much. Thank you for instilling again a wave of positivity, hope among the dental surgeons because, until last 5 years, we've seen a lot of talent also going outside the country just because they thought there are not enough opportunities here. They were not there just because of lack of
Correct.
patient awareness. And if we all come together, we can raise the bar of dentistry in India and create so much of pool that the talent sourcing will be the other way, right? Not people going from here to there, but professionals coming in India because of the opportunities.
Correct. Correct. Absolutely correct. Yeah.
All right. So with that, we end our today's session. I hope all of you had an amazing time listening to our conversations and drop for any queries that you have. We have all our information with respect to impact program and what we had the discussion today in the description below. Thank you so much.
Thank you so much, Dr. Vidhi. And it's really great. I wish you all the best for the ventures that you're into. And I hope to see more of collaboration with you in the future. And let's see, how we can basically try to make that impact that you're doing. So congratulations and thank you for
Thank you.
inviting me.
Thank you, Shirin. You may wait for a minute. I'm just pausing.